just wanted to hand you that as well. That's more information on the vaccine themselves. So if you want to read up on that, information that goes along with it. And I also left my number and email on the card we gave you. So if you have any questions.
Because the N95 presses and really, really hard.
Then on that sheet that we do home meds, just say C standing orders. I almost always.
Good morning.
And what our the general sort of view of this, I think, is that as the pandemic gets better, we should be pulling back on restrictions. The conversation now is about what should determine when that happens. And it's likely going to be some combination of the hospitalization rate, our hospital capacity itself, which is about healthcare staffing, about the death rate, and also just about where we're going in terms of cases. Are we on the rise or are we on the decline? This is actually the evaluation the CDC is doing right now. Now, I recognize that some states have already moved forward and designated future dates where they want to remove the mask requirements in different settings. Some are saying they want to do it across the board. Some are saying they want to do it everywhere but schools. States are moving in different places at paces and with different sort of rules around this. But the bottom line is that we not only have an obligation to be clear with the public about how we roll these back and when that should happen, but we also have to have a clear plan for protecting those who are more vulnerable. And we know that there are people in our community, particularly those who are immunocompromised, who may continue to be at higher risk, right? And that's why it was so important that President Biden sent 400 million high quality masks out to the public that were freely accessible. Because if you have a high quality mask on, that's actually one way that you can help protect yourself. A lot of people thought that, hey, the mask only protects other people, it doesn't protect me. But a high quality mask actually can help protect you as well. I can see a future where we can live our lives where we treat COVID like other respiratory viruses, where we're cautious, where we stay home if we're sick. We may even choose to wear a mask if we're sick, so that we protect other people. We wash our hands, try to ventilate buildings better, but that we do a lot of the things that we did before. Go to school, go to work, see our family and friends, go on trips, enjoy life the way I know many of us want to do. I can imagine that future. I can't tell you if it's coming in a couple months or in 6 months or in 12 months. I can't tell you exactly, but what I can tell you is that to live that future, we are going to need the tools that we've been building over the last year. We're going to need readily available, not vaccines and therapeutics, and we're well on the way to having the supply of therapeutics we need. We're going to need those freely available high quality masks and tests. And we're going to also need the right mindset, recognizing that COVID is not going to disappear overnight. We may see waves of old or new variants, but if we have these tools, if we're using them well, particularly our vaccines and boosters, we can protect the vast majority of people from hospitalizations and deaths.
You want to run? I don't like running. I can do half of
You can't necessarily legislate your way out of stigma. That's a cultural change we all have to play a role in. But where Congress can make a big difference is in focusing on expanding access to treatment, making sure that we are integrating primary care with mental health services, that we're expanding our pipeline for mental health professionals, and we're doing that in a diverse way, because right now only 2% of the 41,000 psychiatrists in our country are Black, for example, which is just a reflection of the lack of diversity we have in our mental health workforce, and that has direct implications for providing care. But lastly, Congress can play a role in investing on the prevention side as well.